So we have Beverley Zwicker. Okay, I hope I pronounced it correctly. Okay, awesome. Now, she is the CEO and Registrar of the Nova Scotia College of Pharmacists. With over 2 decades of experience in pharmacy regulation and practice, she has been very instrumental in advancing regulatory modernization and workforce integration in Nova Scotia. She has played a role in efforts to streamline licensure pathways for internationally educated pharmacy graduates, aligning regulatory framework with public health needs and equity principles. Under her leadership at the Nova Scotia College of Pharmacy, she has championed collaborative approaches to address healthcare system challenges and enhance patient care. Beverley is widely recognized for her commitment to innovation, professional standards, and of course, fostering inclusivity within the pharmacy profession in Canada. Audience, please help me welcome Beverley Zwicker, who is being presented next.
Thank you, appreciate that. Thank you very much. Nova Scotia College of Pharmacists, and so we are the regulator of the profession in Nova Scotia. So we'd be the equivalent of the MRA. We call ourselves the PRA, Pharmacy Regulatory Authority. And I thought I'd begin by, if you want to just advance to the next slide, starting at about the 50,000 foot level, just to give a sense of like, I really appreciated the previous presenter saying there is the national associations and then there are the regulatory authorities. And how does this fit in our societal framework of providing safe care to patients? So professions have a social contract whereby the public gives certain individuals an exclusive right to provide care, to have a very, sometimes a very lucrative occupation, where only they can perform these activities, only they can have these career jobs. And in exchange, the profession gives an assurance that that care is going to be provided safely, that there will be quality, and that there will be ethical expectations for anyone who's going to provide them that care. The regulatory authorities, they sit as the organizations that fulfill that contract and make sure the professions are fulfilling that contract of the care is going to be provided in a competent, safe, and ethical manner. And there's a number of ways that regulators do that. It's a very multifaceted approach, but one of those key pillars in assuring safe, quality, ethical healthcare is licensing. It's that aspect of making sure that the individual actually has the capacity to competently and ethically provide care. So with respect to licensing requirements, they're established with the goal of enabling the regulator to be satisfied as to whether the individual who's applying has the capacity to competently and ethically practice. And the requirements are established as safeguards for correctly making that determination. And they typically, for at least in pharmacy regulation, we think of them in the areas of professional education. Is the core education sufficient to give people that foundational understanding that they need? A competency assessment, which is aimed at making sure that a person who has completed the education, it has had the intended impact, that they truly have gained a competence to be able to perform entrustable professional activities. Character, does the person have the character to be able to ethically provide care to patients in a way that's in the patient's best interest? Practice and system rules. Does the individual understand the system in which the care is being provided? I appreciate Dr. Santos, he indicated that you can have knowledge and education from quality education from another country, and it is provided in a way that enables that person to apply those knowledge and skills consistent with what that person's role is in that country and within the system and that broader system of safeguards. So it's really important to understand what is the framework, particularly for Nova Scotia, what is everyone's role and where are those safeguards to make sure that that's understood so that the framework of safety is maintained. Language proficiency is a key part of that, and then continuing competence, that currency of practice. And there was a lot of conversation in the last session just about how do we do that. So these are the areas that licensing requirements are aimed at making sure are addressed. So as the regulator, again, we have a mandate to assure safe quality practice. And when it comes to licensing, we have a responsibility to ensure that we license all who have the capacity to competently and ethically. For us, it would be practice pharmacy in Nova Scotia and wish to do so, and to only provide a license to those. So we've been really good at the second part. We only provide licenses to those, but in reflection, we realized we may not be hitting the mark on we're giving it to all. The reason is that in meeting this responsibility, licensing requirements that assure only those professionals who have that capacity, you can put the bar really high in a number of ways. But in ensuring that you license all who have the capacity, you need to make sure there are no inappropriate barriers in place that are preventing those who have that capacity from being able to. And there's been research over the last several years in the area of how to effectively assess the competency of an individual that really it positions us to be able to do better in the first. And it's slowly being adopted. And I would say in pharmacy, certainly in Nova Scotia, we're the first province to be taking a look at it and saying, okay, how do we meaningfully take that research and bring it to our work so that we are widening the door to the profession without lowering the floor? Because there's a lot of people who think, oh, you're going to modernize the pathway, somehow we're creating risk. It's imperative that we don't create risk, and it's certainly possible to do that. I would go further and say that bringing research and evidence of how to better effectively assess the competence also enables the regulator to do a more effective job in assuring those requirements are met for those who are trained in Canada as well. So this isn't just about making provision so internationally trained graduates can now have access. It's actually bringing evidence base to improving our systems generally. So for us, that means adopting in a trustable professional activity-based programmatic assessment of competence to practice in real life care versus completion of some of these high snake snapshot examinations. So, you know, that has been our mainstay, our one and only tool, if you will, in our toolbox of assuring competence. And so I'm going to be sharing just a little bit about the work we're doing to do that. As we do this work, we have as one of our values that we will keep equity at the core of our work. And so in our work to modernize license pathways, we realize that keeping equity at the core of our work means that as we modernize these license pathways, that we need to commit to ensure that we are widening the door so that it's accessible to refugees. Because there are unique challenges for people who are refugees that if we don't intentionally address them, these pathways will not be accessible to them, while always making sure we're not lowering the bar. We can't lower the bar, but we can widen the door. So this has us looking at the requirements established for those different areas. This is a bit of it's a quick summary chart. So, you know, it's simplified. So it's not comprehensive, but just to give a sense, here's those down the left. These are those areas that we said that we need to be turning our minds to: the education, the competency, the character, their understanding of rules of practice, and our system, language, and continuing competence. In the first column, this is sort of our traditional licensing pathway to ensure education for those. When we're looking at inside Canada, we have a national accreditor of programs. For competency, we have, so the equivalent of the Medical Council of Canada that was just here, we have the Pharmacy Examining Board of Canada. So they are the national organization that we conduct our certification exams. For character, we require criminal record check. For understanding rules of practice, we have an open book JP exam, jurisprudence exam. So all of our standards of practice and our regulations are on our website, and we have an exam. We expect people to understand how to navigate, where to go to understand where the rules are, and understand that there are rules. And so it's an open book exam. Our language, depending on if you're a Canadian, we trust that because you've gone through the Canadian program that your language is addressed. And then our continuing competency currency, we have structured practice experience. So then if you look at the next column that has, again, in black, because this would have been our traditional. If you were licensed outside of Canada, for a long time, we considered everyone to be a homogenous pool. And everyone, there was only one license pathway. You had at the PEBC, you had to do an evaluation exam to determine whether or not that core foundational education was equivalent. You needed to pass the PEBC certification exams, which were really written to be completed by people who just completed their Canadian programs. You need your criminal record check, the JP exam, the language policy. So that is it's an IELTS 7 for all areas except for writing, which is a 6.5. And then we had internship modules. Recently, so the Patient Access to Care Act was created in Nova Scotia in April of 2023. And that was legislation introduced by the government to allow the regulators to have the authority to more nimbly address licensing requirements that we would identify need to be addressed in order to ensure the public interest is served, in order to ensure that we are able to license all who have the capacity to competently and ethically practice. And it allowed us to get into the reality of the international community in terms of where people are trained to be a pharmacist is not homogeneous. There is a wide variation. And so right off the bat, we were able to say, okay, there are in the US, Australia, New Zealand, UK, and Ireland, we looked at those jurisdictions, their education, their competency assessment approaches, their licensing structure is substantially equivalent to Canada, and we can trust a license provided to a pharmacist in any of those countries as assuredly as we can a license provided by Ontario or Manitoba or BC. And so for those countries, we consider that license to be equivalent. All you need to do is write the JP exam, because that's what the Canadian provinces have to do as well, and you can be licensed. We identified that was low-hanging fruit, and that more work was done. There's a broader international community. And so in looking at the broader international community, we recognize there's an easy path forward and there's a road to better. And one of the sort of value statements or guiding principles that we work by at the Nova Scotia College of Pharmacists is that the road to better and the easy path forward are two different roads. And the road to better is always worth the effort. So we're on the road to better. We began work in just in December 30th of this year to create a policy that we are piloting. So I appreciate some of no more pilot projects. Let's have pilot policies. So we're with you. So we created a pilot policy that has us right now. We're focused currently in Jordan, and we've been there 3 times. I've met with all the schools, looked at all the programs. We've done a tremendous amount of work, and I'm pleased to say that we are piloting a policy that is looking at alternative ways to look at education. So there's international accredited bodies. The ACP is the American, and we also are Canadian, does provide international, but a lot of the programs currently in Jordan have ACP international accreditation, and we work with subject matter experts to confirm what we can understand from that accreditation, what that means in terms of what we know about the education. In looking at competencies, we realize, again, this is where we're bringing forward what we, the research around entrustable professional activities, and we've identified that rather than looking at surrogate markers or indicators of whether somebody who's completed a program and completed a certain amount of practice is competent, we will assess the individual. And so rather than making assumptions about how much time should or shouldn't that person have practiced, this is particularly important for people who are refugees, because in countries such as Jordan, there is a surplus of pharmacists, and they are actually, it's a closed sector. So if you are not Jordanian, you can't get licensed in practice. So you're completing your education. There are ways that you can practice. You can volunteer. There's arrangements that can be made, but certainly nothing that would be easily documented and being able to provide to the regulator. So we stepped back and looked at that and said, okay, why do we require that? We require that because for us, it's an indicator or an assurance of currency of competence. What if we just assess the individual? So we actually have a screening that we conducted in Jordan using sort of a simulated OSCE type of assessment. We just completed that in May. So we are to screen applicants for a level of competency that we would believe would position them well to be successful when you continue on. The second part is a practice readiness program. So what we've developed is a programmatic assessment approach for our practice readiness approach. So there is orientation, there is training in how to bring those knowledge and skills and apply them to the role of pharmacists in Nova Scotia, because the role of pharmacy in Nova Scotia is very broad. It's leading globally in terms of how pharmacists are bringing their knowledge and skills to providing care. So it's a very attractive place to practice. And so our practice readiness program is both an orientation and a training for how to do that. And as well, so we say formative assessments and mentorship, and also trained assessors, independent, that are providing summative assessments along the way to mark how is that person progressing towards independence in entrustable professional activity. So I'm not going to get into the weeds too much, other than to say, really standing up a program that is, for now, we're certainly focused on its utility for assessing the competence of internationally trained pharmacists, but we certainly see that as, looking forward, this is perhaps the way that we should be looking at assessing all applicants for licensure, including those who are trained here. And those are conversations we're having at the national level, but it's still early. But just to say, this isn't lowering the floor. This is bringing evidence to how we approach it. Character, we're looking for immigration purposes. IRCC does an extensive, again, because these are individuals who are screening before they ever come to Canada. So we're doing that work in the home country, so that when people are then coming here, they have an assurance of licensure and employment. And so then the last step is immigration. And I would say, I'm looking forward to the panel later. There's a narrative out there that the regulatory bodies are the barrier. I think there's a lot of work that we could do around aligning with immigration as well, because I know we've done a lot of work to address licensure barriers, and there's people are still struggling with some of the immigration challenges. So I think working regulators and immigration, IRCC working together, which we are on this project, I think is really critical. Okay, so the road to better, a modernized licensing pathway. It is work. So like I said, we've been, it's not quite 6 months. We've approved a policy. We are implementing the policy. We've had our intergovernmental meetings. We've met with the schools. We're collaborating. The schools there are also interested in how they can stand up some programs or have some resources to better enable people to be successful. So the collaboration with educators, immigration, employers, it really does take, it's a complex issue, and it really takes everyone working together. It's not just the national, like the Medical Council of Canada or PBC. It's not just the regulators. It's not just immigration. It's let's come together and figure this out. It is a solvable problem. It is a path to better, but it does take work. I just put at the bottom, there's the chart that at a high level maps out what we're doing. So we're pre-screening on the Jordan side for both competency and employability. In between, we're actually doing some pre-departure orientation and training. So there's English training in sort of curated for pharmacists, as well as some training modules to help understand what is practice going to look like here. How do you take what you've learned in pharmacy in Jordan and bring it forward to how you will be expected to provide care in Nova Scotia. We're we're also going to be working in the communities to prepare the pharmacies and the communities for accepting and embracing internationally trained pharmacists into their communities, because we realize that's a big part. And working with our settlement support people as well. So when the newcomers from Jordan arrive, they will have the wraparound supports they need, because they're both transitioning to providing care in Nova Scotia and to settling in a new country. And where those who are refugees, with all of those other challenges that they're bringing, given their history. Another truth that we keep in mind is that refugee is not something that it's not who people are, it's what's happened to people. And so, recognizing that a lot has happened to people who have refugee status, that you also need to keep in mind for them, and as a regulator, for the care of the patients that they're being provided. Happy to take questions. I would say that just thinking about some of the sessions that we've already heard, the why in this is really important. And I think it's really important to emphasize that this isn't just about addressing a workforce shortage. This is about strengthening the diversity of our workforce, which will make us stronger and better in terms of care provision to patients. What we've already identified is individuals who are trained in other jurisdictions. It's not like they need to come up to our bar, and our bar is the highest bar. Many have training in some areas that exceed what we provide here in certain areas. Coming together and sharing with each other and sharing what we've learned in terms of practice providing care makes us all better clinicians and makes us better care providers. In addition, as somebody also identified, we live in a diverse population. People, when we worked with the public, they said, we would value if there were people who had more of our experience providing us with care. So in diversifying our pharmacy workforce, we're actually doing what we should be doing in meeting the public's need for quality pharmacy care. And that is making sure that there's representation of their needs and their experiences in the healthcare workforce. So I just wanted to flag that. So right on time, 11:40.
Right on time. Okay, so Beverley, we do have it's more of a statement and then a question here.
Sure.
So this one is I'm a registered pharmacist intern with Nova Scotia College of Pharmacy.
Yep.
Living in Sydney, and I'm struggling to secure a place to start internship. So we're looking at strategies to facilitate students or to guide students to secure a place to start their internship here in Nova Scotia.
Yes, so we have multiple partners that we've been working with, including our Department of Health and the Pharmacy Association, and there is an initiative called RxNS.ca. The Pharmacy Association has somebody who's helping to link people to opportunities, so that is something that might be a resource for them. It's hard to answer a question very specifically on the fly, but I did want to flag, and I appreciate the question. This is a pilot policy, really important, but it is very specific right now to this cohort. Once we have implemented it, we've learned, then we will be looking at how do we scale it up broadly. But right now, it's just for this particular initiative that we have. It will inform what our licensing pathways will be broadly going forward. But for right now, what I've just described is just for those that candidates that we're recruiting and bringing here in the fall from Jordan.
Awesome. In terms of those countries, so you mentioned Jordan.
Yep.
This person says Sydney, so I'm thinking that person is in Australia. Are there any programs that or other countries that tie into that program?
Sure. So I think Sydney might actually be Sydney, Nova Scotia. So I'm thinking that person is actually
Sydney.
Sydney. I think they're in Cape Breton.
So tell you, I'm from Ontario. I'm sorry.
That's okay. You'll forgive me for that.
Awesome.
Yeah, and I would also say, because before I step away, I will make a plug for. I know that people think a national licensure is so complicated. If there was one license, that would be so much better. I would strongly encourage you to think carefully about what you're wishing for. because one national licensure means one set of requirements, and it would not enable the innovation and pathways, for instance, that Nova Scotia is creating. You would need to get consensus of all the provinces. So you think you want national because we want everyone to give us all of the innovation. That's not likely the way that plays out. So I think enabling every province having the authority to create pathways sets up Canada to be innovative. One province does it, another gets to adopt it. So I just wanted to highlight that.
Okay. All right.
Thank you.
So thank you so much, Zwicker.